What I did was a kind of review of the talk I gave at ASH last year on the pooled analysis and longer term follow-up of Ibrutinib in mantle cell lymphoma. And I think the bottom line, the underlying theme is earlier use equals better outcome, not just with respect to progression-free survival, probably overall survival, but also toxicity. Earlier use of the drug, you actually get fewer side effects. Not the sort of cardiac type toxicity, but infections, hematological toxicity, less the earlier use of the drug. So I think it's just becoming very clear that as the most effective therapy there is, that moving it earlier into the treatment algorithm is clearly what we should be doing, and obviously frontline is the next place. I think meetings like this are increasingly important, particularly from an education perspective. The most important data is always presented at the biggest international meetings, and it's increasingly difficult for people to get there. So the role of a meeting like this is to distill the important practice-changing trial information and present it to an audience in a way that's easy for them to access. So that's very important. I've just been at the session where I was presenting the Ibrutinib data, but also that session with very much the practice-changing abstracts from ASH, all at the same time. If you wanted to see those abstracts at ASH, you'd have to be running all over the building. So distilling that in a format that's valuable for, all of us is really useful. And I think embracing digital technology, having education in different ways, in bite-sized chunks that people can access easily. It's increasingly difficult for people to get to meetings like this. One of the things that BSH has struggled with really is engaging with non-doctors, particularly the nurses, and I think we have to think of ways where we can target education for their needs in a way that's accessible for them, which doesn't mean they have to come to this meeting and sit in the same sessions. So I think we have to think about that in a different way.